Welcome to Chapter 7. In this chapter, we will talk about the most commonly used therapy or theory, person-centered therapy. Coming off the Module 1, where we talked about existential therapy last time, you will notice both approaches share a deep respect for the client's subjective experience. But where existential therapy asks clients to face the hard truths of existence, for example, talking about loneliness, meaninglessness, and death, person-centered therapy asks something different of the therapist. It asks you to be a particular kind of human in the room. That is the central claim of this approach. That who you are as a therapist matters more than anything you do. Keeping that idea closely as we move through the chapter will help you understand how this client-centered approach applies into our role as therapists. By the end of this chapter, you will be able to trace the 4 periods of development of PCT, person-centered therapy, describe emotion-focused therapy and its roots, distinguish Roger from Maslow in their contribution to humanistic approach, explain the 3 core therapist conditions, discuss how the approach applied to crisis intervention, group counseling, school setting, and expressive arts. Evaluate its strength and limitation in multicultural contexts, and identify its broader contributions to the field. The through line connecting all of these is a single question Roger spent his entire exploring. What conditions are necessary for a person to grow? And we will see he proposed 6 necessary and sufficient conditions. And I also plan to add a brief lecture on motivational interviewing, which is a slightly different spin on person-centered therapy. Let me turn the transcript on. Okay. Person-centered therapy rests on 3 foundational commitments. First, it places the personal characteristic of therapists, not their techniques, right? As you can see, therapist as a person that matters significantly. That is the first one. Second, it elevates the quality of the therapeutic relationship above all other variables. So what kind of relationship? And you know from research, if you look at any research that is done on psychotherapy, you often see the relationship between client and therapist. The other term is the alliance, right? That you build with your therapist. So client therapy relationship becomes the critical aspect, and that comes from person-centered approach. And third, it trusts deeply in the person's own capacity for self-directed growth given the right condition. And this is a huge shift, right? Instead of being the expert, you try to believe and you try to instill that hope that client can make that progress on their own if you give them right condition. And we will see what are those conditions. So this is a radical departure from the prevailing assumptions of Rogers' era, when most therapy are directive, expert-led, and assumptions-heavy. Roger was saying the client already has what they need to heal. Your job is to create the environment in which that healing can happen. Person-centered therapy evolved through 4 distinct periods. As you see here, in the first, the directive period, Roger offered a powerful counterpoint to directive and interpretive approach. When you say interpretive, remember in Freudian approach, you are the analyst. When client shares their unconscious ideas or their experience, therapists typically give the interpretation. But here, that's not what we do. In the second period, client-centered therapy shifted the emphasis from method to the client's frame of reference, right? You try to understand the phenomenological approach where you try to see what client is talking about. The third period is the most clinically significant. Roger articulated the necessary and sufficient conditions for therapeutic relationship to happen or therapeutic change to take place, which we will examine later in deeper. The fourth period marks an expansion beyond individual therapy into education, couple, family, and industry, and other field. So as you see, Roger is actually listening to these ideas and asking what helps them. And in the side note, I'm teaching a graduate class where students are learning about community mental health. And we often bring this topic up. As a marriage and family therapist or counselor, is your role limited to offering one-on-one therapy? And the simple answer is no. You can play a critical role in mental health when you go to community, whether it is a school base, community base, whether it is an outreach program, reaching out to people in their own places. So counselor can play a significant role. And as you can see, it might have somewhere started from these kind of theories. Emotion-focused therapy developed by Leslie Greenberg grows directly from the person-centered tradition, but brings in elements of Gestalt and existential therapy as well. Its core claim is that emotional change can be a primary path to cognitive and behavioral change. In other words, you do not always think your way to a new feeling. Sometimes you feel your way to a new understanding, right? EFT helps clients who are emotionally shut down access what they are actually feeling, and it helps clients who are flooded by emotion and find ways to regulate and contain that flood. It is evidence-based and has demonstrated effectiveness with anxiety, trauma, eating disorder, and intimate partner violence. For a student trained in cognitive approach, you may find that EFT, right? If you are familiar with cognitive therapy, behavior therapy, we will talk in later. Emotion focused therapy will be extremely important because you understand emotion seriously not as a byproduct of thinking, but as data and as a vehicle for transformation. And even in Freud idea, we talk about emotional catharsis. When you are allowed to express emotions, there is a dawn, that brightness comes in. And emotion focus is very much embedded in regulating emotions, identifying those emotions, and express them in a right way. So it's almost relative and corrective experience of emotions. And Abraham Maslow's contribution to humanistic psychology complements Roger in important ways. Maslow's hierarchy of needs, you may have seen the pyramid that you often see in pictures, right? There are some basic needs, self-esteem need, relationship need, and self-actualization. This is like a top self-actualization. So human typically behave from motivated by meeting the very fundamental needs, like the basic needs, like air, water, food, shelter, whatnot. And then they think about the safety need, right? They want to be safe, they want to have a shelter, and then move from safety to belonging, right? Belonging is you try to be part of community, part of certain group, part of certain club, and that's where you continue to develop. And the next one is esteem, right? Esteem, I'm sorry, this handwriting is not very clear. Esteem. So the basic needs, safety, belonging, esteem, and the final step is self-actualization. Now, self-actualization can vary from person to person. Some people might think self-actualization would be getting a doctorate degree. For others, perhaps just getting a master's or getting a license to become a therapist. For others, having two kids, having a house. It varies from person to person. Nonetheless, Maslow also described this characteristic of self-actualization based on the people, those who have actualized, found that those individuals who you consider self-actualized people, famous characters, are self-aware. They have freedom. They are basic honesty, trust, and autonomy. And these qualities map directly onto what Roger believed that therapeutic relationships should cultivate. The broader positive psychology movement, started by Martin Seligman, who merged decades later, what Humanistic Foundation talked about personal growth into positive psychology. So as you see, people are motivated by these basic needs. And when you think of how do we get them to the self-actualization level, the biggest part is having that self-awareness, freedom, knowing your own strength. And client-centered approach try to cultivate those qualities. Rogers held a fundamental optimistic view of human nature, as you can read here, one that was and remains very controversial sometimes. At the core, he believed that people are trustworthy, that they move naturally toward health and growth when conditions allow, and that they are capable of living productive and effective lives. This is not naivety, right? As you can see, Roger was fully aware that people cause harm, become destructive, and get stuck. His point was that these outcomes are the result of thwarted growth, right? They are not allowed to grow, which is as the result of environment that fail to produce or provide the conditions people need. If a plant does not grow well, we do not blame the plant. We look at the soil, the light, the water, the nutrition as needed. And client-centered or person-centered therapy operates from the same logic. The question is, always, right? What conditions are missing that would allow this person to grow? And think of any time you have a client who seem to struggle in a relationship, struggle in thriving for their own success. You may see that the struggle is not necessarily innate. It's not that they don't have the ability. I know there are certain conditions, like people, if you talk about people with learning disabilities, intellectual disabilities, and sometimes neurodevelopmental conditions, they may have certain limitation because they're organic causes. However, most of the time, people those who are struggling with mental health challenges, they are missing some conditions. That again, from the Rogers' point of view. So the therapist's job in person-centered therapy is to create what Roger called a growth-promoting climate, as you saw an example of plant. And he identifies three specific conditions that defines it. The first one, as you see here, congruence, right? Also, genuineness or realness means that therapist is not hiding behind a professional facade. What you feel inside, what you communicate, and what you communicate to client are aligned. There is a congruence in therapist's approach, right? Unconditional positive regard. You may have heard this before, which means to accept and care for the client without conditions, without needing them to behave differently or improve to earn your warmth. Now, I want to take a pause here and I want you to think about people that who, in your life, you try to communicate and you find you are unable to grow because there is constantly you experience judgment, you experience guidance, direction, and that is what we're not going to do. So you are accepting people, caring for people regardless of their flaws, regardless of their nature. It's not an easy job, right? Accepting people as they are is very hard, and that's what therapists are there for, according to Rogers' approach. And accurate empathy, empathic understanding means you can enter deeply into the client's subjective world, right? Not just intellectually understanding their situation, but genuinely grasping how it feels to be them. These three conditions are not techniques, they are always of being. They are ways of being. And Rogers' controversial claim was that these three conditions, when genuinely present, are not just helpful, they are both necessary and sufficient for therapeutic change. Think of somebody who is struggling, right? Constantly trying to prove themselves, who is incongruent. You will see those factor what client experience. And therapist is congruent. That means they're genuine. And accept them as they are, care for as they are, and emphasize uh, ex- have that empathic understanding of client's experience rather than making assumptions or implying how that feels. On the other hand, from the client side, person-centered therapy provides something many people have rarely experienced, a space to fully explore their feelings, beliefs, and worldview without being judged, corrected, or directed. Take a pause and think about your experience, right? You try to share your struggle with family members or friend, even professor. You often hear tone that is judgmental. You often hear corrections that is unhelpful. You often hear being guided to a solution. Again, that is not what you're seeking. So many clients arrive hoping the therapist will give those answers, and sort of you're trained to expect, right? But they again, client want them to once the therapist tell them what to do, solve the problems, provide the map. However, person-centered therapy resists that pull. Instead, the therapeutic relationship itself becomes a kind of corrective environment. When a client who has spent their life being criticized, dismissed, or conditionally loved encounters genuine acceptance and deep understanding, something shifts. The self-healing capacities that were suppressed by those early conditions begin to reactivate. Think about a time someone trusted or truly listened to you, not to respond, not to fix, but just to listen, just to understand. What does that feel like? This is the foundation of what this approach offers. My experience working with an inmate in Sri Lanka really resonated this experience. The client, and just a brief story, this client was incarcerated for a lifetime because the crime was a murder. And he shared his story. It's a long story, but I'll keep it short. I was exposed to client-centered therapy in my undergrad, and I was doing intern in a jail, and I listened to this client for about 45 minutes. I tried my best to be present, like you saw in the conditions, show that unconditional positive regard, care for the client, and try to understand his pain. He had a dent on his skull because of the as a result of the altercation with his brother, and which is the person he murdered, according to his story. And about 45 minutes, he was complaining about pretty much everything you can point. I listened to him. It was very hard. I was getting a little tired of listening and just accepting and you know showing that I care and I hear him. After 45 minutes onward, I saw a change. I started noticing there's a shift in his conversation. Instead of complaining, I heard him solution that he came up with on his own without my direction. So when you say, when somebody listens to you, accepts you genuinely, your self-healing capacity, even in that inmate who is actually incarcerated for a lifetime, start to tell me such a positive outlook of his life, which I could not do on my own. So just like a example of this technique, how it could guide people towards self-healing pathway. So Roger proposed 6 conditions that are necessary and sufficient for therapeutic personality change. The first two: establish the relational foundation. Two, people must be in genuine psychological contact, right? That is client and therapist. And the client must be experiencing some degree of incongruence, right? There is somewhat ingenuine about or unreal about client's experience. But the therapist must experience unconditional positive regard for the client. You, as a therapist, accepting client as they are rather than trying to use your lenses to see them. Real acceptance without condition. The therapist must experience accurate empathy, and that doesn't happen unless you listen to their story, try to feel their emotions and their lived experience so the client can receive it. Notice what is not on this list is assessment tools, treatment plans, theoretical frameworks, or specific techniques. Roger making a radical empirical claim that the relationship itself, when these conditions are met, is what heals. So he focused so much on relationship between client and therapist, which you see a lot. And in my other in-person class, students often bring up question: is this the most commonly used technique by new therapists? The answer is yes. If I ask my colleagues, people who just started working as counselor and therapist, they often resort on client-centered approach because it's a way to build autonomy. It's a way to help them find their solution rather than having all the solution for your clients. So the therapist in person-centered therapy is not a blank screen or a neutral observer. Even you think you're just being there and listening. They're a person, right? Actually working on their own growth, willing to be genuinely affected by their clients, and modeling through their own presence what authentic living can look like. Roger described the effective person centered therapist as someone who is continuously developing their own self knowledge, who are expressing who can express feelings openly when appropriate, and who is integrated enough to bring their full self into the room without using the session for their own needs. And there's a big part in immediacy, right? It should be somewhere here. Immediacy. So immediacy is another important concept here, the ability to address what is actually happening between therapist and client in the moment is very important, very valued. A trainee in a practicum who notices they're feeling a certain way toward a client and can name that moment honestly is practicing this quality. It could be uncomfortable, but it is also transformative. So our job is to make sure that you're aware, like a self-knowledge, you're aware about your feelings and try to express them in the moment. And just to remind you, actually, these are the how the relationships should be between client and therapist. There is a common misconception that person-centered therapy is passive, that the therapist simply reflects feelings back like a mirror and says very little. That was true of the earliest non-directive period, but the approach has evolved significantly. Roger moved from a narrow reflection of feelings technique to a fuller, more active engagement with the client. Being with client means entering imaginatively into their world, not just tracking content, but attending to the emotional texture of what they're sharing. Effective listening in this model is not merely the absence of directing. It requires the therapist to be fully present, genuinely engaged, and willing to adapt their style to the unique needs of each client. When Roger listened, when any therapist with the person-centered therapy approach listened, people could feel that they were truly being heard, not processed, not categorized, but known. The quality of presence is what trainees are working toward, and that is what we practice when you use this method. It has evolved. So just the point is, it's not always non-directive, it has evolved. How do you apply? One of the most clinically important application of person-centered principles is crisis intervention. As I mentioned, it's not only during one-on-one, and it can be applied that could surprise a lot of new students. When someone is in acute crisis, the instinct, especially for trained helpers, is to move quickly to solve problems, safety planning, and directive actions. Person centered therapy argues that before any of that can be effective, the person must first feel genuinely heard. When someone calls a crisis line, walks into an emergency room, or breaks down in your office, the first thing you need to do is to allow them to fully express what they're experiencing and to feel met, right? Not assessed, not managed, but understood. Roger talk about communicating, deep sense of understanding should always precede other interventions. Genuine support, caring, and non-possessive warmth can motivate people to engage with problem solving in ways that commands, directives, and urgency alone cannot. So the research on crisis response constantly confirms the sequencing. And when you think about the training I offer, mental health first aid, we talk about trauma and supporting after trauma. In mental health first aid training, based on evidence, we often tell to listen. And that listening comes from this way of allowing them to be heard, right? Very important. And sometimes silence could be very powerful, right? As an expert, you may have a lot of suggestions, you may have a lot of knowledge, but sometimes people just need to be heard. And that's what Raj is proposing. In addition, there is another approach here. You can see Natalie Roger, Carl Rogers' daughter, expanded the person-centered approach into arts. And the result is person-centered expressive art therapy. And you might like this to work with children, teenagers, adolescents, and even young adults, right? And that people are allowed to use their innate creative capacity, not just artists or musicians, but everyone. And the creative process, when it unfolds in a safe and accepting environment, is inherently transformative and healing. The principles draw directly from person centered philosophy, the conditions of acceptance, empathy, and psychological freedom applied equally to the creative process. When clients use these movements, such as moving their body, visual art, writing, music, and therapy, they are assessing parts of their experience that word cannot express alone. This is especially relevant for clients who have experienced trauma, for children and adolescents, and the client who has limited word expressions, right? Or constrained by culture or language or shame. So the art form becomes a language when language alone is not enough. And in my in-person class, I invite students to bring materials to practice this art therapy. And I want to invite you, take a pause and think about how can you translate this expressive art therapy in your life. And it is about, just like what you learned, what we heard about accepting. If somebody does a piece of art, whether it is playing an instrument or writing a short paragraph, accept without any conditions, express that empathy, allow that freedom. That is the purpose, right? It is way to self-discovery, self-awareness, and add insight about their experience. PCT have genuine cross-cultural applicability, and the case for this is worth examining carefully. Carl Rogers' work reached more than 30 countries and was translated into 12 languages. That kind of reach suggests the core conditions are not culturally, limited. The therapist, as fellow explorer, stands genuinely curious, open, and non-hierarchical is particularly valuable when working cross-cultural differences. When a therapist approaches a client from a different background with the attitude that the client is the expert on their own experience, that the therapist's job is to understand rather than to prescribe. It avoids the patronism and assumption making that multicultural counseling research consistently identifies as harmful. So if you remember, I thou quality of therapeutic relationship, that two humans are genuinely encountering each other can be deeply affirming for clients who have clinical experienced clinical encounters as impersonal and pathologizing, right? So culturally tone deaf. And this approach is trying to change a little bit and accept people as they are, whether they are from the same ethnicity or different background. That said, PCT carries real limitations. In diverse cultural contexts, that intellectual honesty requires us to name clients who come from cultures where the expert helper relationship is the expected norm, when directive advice and guidance are a sign of respect and care, may experience the non-direct stance as disengaged, unhelpful, or even dismissive. I had a friend from Asia who was seeking therapy for anxiety, and I recommended a therapist who practiced PCT. Didn't work. Every time they went to the therapist, they expected some kind of a solution, some kind of a prescription. So as you hear, it may have some limitation when people are expecting directive and advice and solution. If a client asks when they should do what they should do, and the therapist turns it back with a reflective question, that can feel like abandonment rather than empowerment. The emphasis on individual autonomy and personal growth can also conflict with collectivist values where the common good, family loyalty, interdependence are primary, right? People from Asia, people from African American background, African American community, Hispanic community, they are more collectivist in terms of how they approach their lifestyle. So, translating the core conditions across cultural communication styles is generally difficult. Empathy expressed through direct eye contact, open emotional language, or physical warmth may land very differently depending on the client's background. The approach is not broken by those challenges, but it needs to be adapted thoughtfully as you approach to your new level. The contribution of PCT to the broader field are genuinely difficult to overstate, right? Carl Rogers was the first person to record and publish complete therapy session for research and training. You can find that online, an act that openly opened therapy to scientific scrutiny in a way that was both radical and enduring. The three core conditions have been studied extensively. The research constantly identified the therapeutic alliance, as we mentioned earlier, especially empathy and genuine positive regard, as among the strongest predictor of therapeutic outcome across all models. PC person center principles permeate the practice of most therapists, regardless of their theoretical orientation. Even strictly CBT therapists who would never call themselves person centered typically operate within a warm, empathy, collaborative relationship. As you see, this is very easy tool for people to adapt, right? They have Roger to thank for establishing the relationship foundation as a clinical norm. And Natalie Roger expressive artwork has further expanded this to creative, body-centered, and community contexts. So, to close, person-centered therapy makes a claim that is simple to state and genuinely difficult to embody. That the most powerful thing a therapist bring to the room is not their knowledge, not their techniques, or their diagnostic accuracy, but their capacity to be genuinely present, deeply empathic, and unconditionally accepting. Rogers spent his career listening to what actually helped people change and arrive again and again to the same answer, the relationship in the therapy. As you move forward through this course and begin practicing, I want you to hold that claim seriously rather than sentimentally. What does it actually take to offer unconditional positive regard to a client whose whose choices you find troubling? What does real empathy demand of you when a client is in a place you cannot fully imagine? Those are not rhetoric questions. They are the one that this approach asks you to keep working on for your entire career. I'll see you next video.